Live from KPRC Channel 2, where local news comes first. This is News to Houston first at 4.
Well, it affects more than 1 million people in the U.S., but it's usually diagnosed by accident.
And the news gets worse. Although it kills thousands, there are no symptoms of an abdominal aortic aneurysm. Health Feed reporter Krista Marino joining us now with some good news about what is commonly called AAA.
Right. Well, an aneurysm is just a ballooning of the artery, and the aorta is the most common place for this to happen. And up until now, the only way to treat it was really drastic open surgery. But doctors at the Houston VA are using a new technique to stop this enlarged artery. Using a catheter, they work their way up to the aorta, and with state-of-the-art material, seal it off.
Normal aorta is shaped like a little circle, which sits right on top of the spine.
It is the largest blood vessel in the body, but when it becomes enlarged,
This represents the ballooning of the aortic aneurysm.
it becomes the third leading cause of sudden death in older men.
As you can see, this aorta has ballooned up nearly 5 times the size of its normal diameter.
It's called Abdominal Aortic Aneurysm, or AAA, and it kills 15,000 people every year.
I really didn't realize as serious as it was until after they got to explaining it to me how bad it was.
George Crawley, an Army war veteran, considers himself charmed.
I was lucky. I really was lucky.
Doctors at the Houston VA caught his AAA, which in itself is tricky. You see, there are very few symptoms. Vascular surgeon Dr. Alan Lumsden.
The aorta actually lies in front of your backbone, so it's way at the back of your abdomen. And when patients do get symptoms, it usually manifests as back pain.
And back pain is common.
I had no symptoms whatsoever.
What he did have was a new procedure to fix the AAA. Instead of a huge incision, Dr. Lumsden and Dr. Peter Lynn
Of the aorta, which is roughly 2-3 times.
inserted a stent just like this to open up the aorta.
We use the arteries to deliver the device up inside the aneurysm and seal off the aneurysm from the inside.
More importantly for the patient, there's a lot more comfortable, less stress, and they can go home early. And
Today, Crawley feels great.
It was only a couple of weeks that I had any hurting at all.
And for the first time, gets to see the size of the stent that saved his life.
That's something. It really is.
That is something. Now, the stent is made of a material called nitinol, and that was actually developed by the U.S. Navy. It expands with temperature, and so that's how they get it in. They compress it with a catheter and then work it up. And by the way, the risk factors for AAA include family history, of course, if you're older, in the 5th or 6th, 7th decade of life, high blood pressure, high cholesterol, and cigarette smoking.
The miracle of modern medicine.
It's amazing,
Okay.
yeah.
Thanks a lot, Krista.
Okay.